Okay, so go ahead and start the quiz. I'm going to make sure everybody's muted and I'm going to mute myself. Okay? Okay, it looks like everybody's done, so if everybody can start coming back on camera, that'd be great. You guys are seeing the rationales, correct? Whether you got the question right or wrong, you're seeing the rationales. That's what I want to go through. Yes? Okay, thank you. All right, let's wait for everybody to come back on. The other thing before we get started, I want to tell you is congratulations. I think I already said congratulations, but for exam 1, but congratulations on exam 2. Everybody did okay. So really good job preparing. Whether you attended live recordings or you watched the recordings, it helped, right? So really, congratulations. So we'll review the quiz, but this week we had 2 weeks of content since you had the exam last week. So last week we had community assessment and evaluation and health education in the communities. And then for this week, economic influences, violence and human abuse, infectious disease, prevention and control. So quite a bit. Looks like there were about 6 chapters. All right. So again, I'll remind you, like I do for all the readings in the book, start with the objectives, right? Those objectives at the front of those chapters have all the key questions that you should be able to answer once you review the chapter. Is everybody kind of following along with that pattern? Yeah. If you can answer those objectives, you're doing good. That means you got what you needed to get out of that chapter. And of course, reviewing the Healthy People 2030 boxes, the levels of prevention boxes, the primary, secondary, and tertiary, because as you can see, as you're going through these chapters, all those interventions are for the particular chapter that's being covered. Right? So you really get a good variety of primary, secondary, and tertiary. Okay? All right, I'm going to share my screen. Let's go through the quiz. Oops, I didn't share my screen. Okay, can you guys, everybody see the screen? Okay, let's go through it because I want to make sure that you have an understanding. And of course, on quizzes, it's partial credit for the select all that apply. So you're getting partial credit for the answers you got correct on the select all that apply. But let's go through these questions. All right, so let's see. Let me move you guys over here. Okay. Okay, so during which of the following activities is the nurse in the community, community health nurse acting as a partner in change? So the correct answer here is would be an example, teaching anger management skills to a group of teens that live in a halfway house. What do we know about, what did you learn about community health and partnerships within community health? What did you guys learn about that? Because in community, we're always working in partner with somebody, right? So let's take a look at the rationale. So community is a partner. That's a model. It's based on nursing processes and the theories and emphasizes the dynamic nature of all the community systems and how they're interrelated. Right? One of the key features in the community as a partner model, right, is what the structure of the community is and the subsystems that make up the community. Okay? Subsystems or parts of the community. What is the physical environment? What are the health and social services, or what are the resources? What's the economy look like? Is it a healthy economy, or is it a lot of people struggling? Transportation, what are those transportation issues? Is it a barrier? What's the safety of the community? Okay, what are the politics of the government? Communication, how do people communicate information? Are there language barriers? What's the education look like? Are there recreational areas that people can, parks, walkways, right? So if you're looking at the subsystems of the community, we think about 5 things, and I want you to know this. That it's built into the rationale. But the 5 main categories: politics, education, recreation, the economy, and religion. All those are present in every community. It looks different in each community. One may be more apparent, or one community may prioritize one over the other, but those are the 5 parts of the community structure that are all looked at. Okay, does anybody have any questions about that question? Question 2. A community health nurse encourages members of the community to partner and assist in creating health programs. Which of the following best describes the rationale? So again, this is another question about community partnerships. Okay, there's 2 correct answers to this. We do know that partnering results in increased effectiveness, right? We also know that participating and planning for community activities, they have a vested interest in the outcome. So if you think about it, let's say you have a community that has an issue with violence, right? Does the community team involve law enforcement to help develop those programs? Or is there an increase in violence in the schools? Does law enforcement help with the school in developing the resources they need? What if it's a community that has, let's say, a low graduation rate? Does the education piece of the community partner with the community health nurse to come up with actions to increase the graduation rate? All right. So when we talk about community partnerships, the public health nurse, the community nurse has to operate in a partnership. Whoever's on that team depends on what issues are going on. But we do need other voices in the community to come together with that community or public health nurse once you've done your assessment and figure out what the needs are. What's working, what's not working. That community public health nurse is reaching out to partners in the community to help solve problems or help move issues along. Okay? Can't do it alone. Public health nurse can't do it alone. Okay? And within these partnerships, you follow the nursing process. You've done an assessment about what the needs are. You develop objectives, you develop goals as a team, right? You come up with a plan of action for whatever issue has arisen from your assessment, right? So it's much more effective to be solving these larger community problems as a team. I mean, think about what you got going on in what do we all have going on in our communities? Homelessness. Okay, that requires a team approach, right? The public health nurse, community nurse, maybe mental health services. What else? What else? Who else should be on that team? If you're trying to tackle homelessness, who should be on that team? Who should be on the team? Who else would benefit being on that team? Maybe somebody from the primary care clinic, right? To arrange free primary health visits.
Soup kitchens?
Pardon me?
Soup kitchens?
Soup kitchens, food banks. Absolutely. Let's say you have an issue with education, kids not graduating from high school. That's a community issue. Who's going to be on that team? Who's going to be on that team to try and come up with some solutions or objectives, goals towards increasing the graduation rate?
The
Board of
faculty?
Education.
Pardon me? Maybe the principal of the high school, right? The guidance counselors of the high school, right? Maybe tutoring services, whatever's going to help improve the graduation rate if that's an issue you identified. What about an issue of poverty? A lot of the population lives in poverty. There's a high crime rate, maybe gang activity. Who do you want on your team to help figure out solutions to that? Maybe law enforcement, mental health services. So again, my point is these first two questions are about community partnerships. You can't go it alone. And when you're out working in the community, you got to know who your team players are. Who do you need sitting at the table to help you resolve your issues that you've identified as you do your community assessment? That's my point. Okay? Number 3, nurse wants to determine whether health problems have been improved and interventions have been appropriate and successful over a period of time. What kind of data are you going to examine? You're certainly going to examine demographic data, environmental factors, and the utilization of your health services or resources. Okay, let's look at the rationale here. When you're assessing the health of a community, you need to have paint a pretty broad picture. Okay, because there's lots of things you're assessing. You're assessing the economic health of the community. Does it have a high unemployment rate? Does it have a low unemployment rate? Do a lot of people live in poverty? The social structure of the community. What does that look like? Are there resources available for people? Are there food banks? Are there shelters for domestic violence victims? Are there homeless shelters available to the homeless? And the physical environment, what does the environment look like? Is it a kept up environment? Is it not a kept up environment? Is it dirty? Is it clean? And then assessing the kind of the psychological factor of the community. Are there a lot of mental health issues going on when you do your assessment? There are a lot of elderly with mental health issues. Are there kids in school with mental health issues? And after you've done that full assessment, then you have to assess what are the resources available. You know, one of the things as a school nurse, I had a whole binder of resources in the community, right? You have to be able to know what's available. And if you don't know, where to find it. I always use our local public health department if I needed a resource that I didn't have in my binder. One of the jobs as a community nurse or public health nurse You have to know what's available for resources because every interaction you have, whether it's an individual, a family, a subset of the community, people need resources and everybody's going to need different resources, right? So that's part of your assessment. What do people need and how do you get them the resources? You know, maybe the needs of kids in high school are very different from the needs of the elderly, right? Also, when you do your assessment, what are the strengths of the community? What are the challenges of the community? That's part of your whole assessment. Okay? And that's why here it says it's important to value both strengths and problems in your assessment, planning, implementation, and evaluation. Okay, I kind of talked about this last paragraph, but communities have both resources and they have needs. That's part of your vulnerable populations assignment in week 9. Part of what you need to evaluate are what are the service gaps, right? So, well, you're also assessing resources, right? What is your let's say you pick the homeless population. What does your resource have, or what does your community have as resources for this population? What doesn't it have? That's service gaps. What are the needs? Let's say you're doing teen pregnancy. What does your community have to support teen pregnant moms versus what does it need? Okay. Community strengths can later be called upon in the planning and intervention phases, right? That's resources in the community, maybe people in the community, maybe community members that want to take an active involvement. Okay. What, two terms that you'll see, you guys already got your exam 3 review. Okay. And let's pull it up here because I highlighted a few things. You have a whole section on a community assessment and evaluation. This is right from your exam 3 review. Okay, it talks about doing a community assessment. One of the things I want to mention is what's the difference between an active and a passive partnership within the community? We have active partners that are day-to-day, on board, passive, that are kind of working on things in the background. Okay, so let's talk about this. Right? So an example of an active partnership. Maybe there's a business, a local business in your community that provides snacks, low-cost snacks to an after-school program. That's active. You're going to get a direct result of that daily. Right? They're actively involved. An example of a passive partnership, let's say the city council is planning on improving the parks for the kids or anybody, right? So the group is, they're developing plans, or they're have an architect working on plans, right? They're working on a recreational center. They're working on, what else is in here? Vaccination clinic. Those things are working towards improving the community, but they're more in a passive way. Does that make sense? So please know the difference between an active, which is in there day to day, making an impact, versus passive, which is, it's not, you're not seeing a direct result right away. They're in the planning process of doing things that improve the community. Okay. The other thing about community assessment is there's 2 ways to gather data. Okay. Well, data gathering and data generation. It's right here. You need to, let's talk about the difference between that. Right? When you're generating data, it doesn't exist, right? You have to generate it. Okay? It's identifying data that does not exist, but it's developed through your interactions with the community. I'm just doing a lot of my lecture teaching through this quiz. So bear with me, okay? Right? So maybe that's meeting with people in the community, trying to find out how do they feel about the community? What are their values? What are their beliefs? Okay, what are their social norms? Okay, and the other data gathering is pulling together information that's already present, right? What are the demographics of the community? Okay, what's the average age? What's the racial distribution? So those are the two differences in the way we gather data. Okay? So, as a community health nurse, community assessment is key, right? How do you know what the community needs if you can't do an assessment of the strengths and the weaknesses of each community? Okay? And who are the stakeholders? Who's the stakeholders in the community that are going to help you out? Okay, let's talk about education. The nurse is planning an educational program about cardiovascular disease. Which of the following would be an optimal time for the nurse to try and get feedback from program participants? Why is D the correct answer?
Because you don't want to do it at just one point. You want to do it throughout the whole thing.
Right. Well, and why? You always want to be checking in, right? You always want to be checking in during an education program. Is it going the way you planned? It may not be, and you might have to refocus, right? Or rethink, right? So yes, you would do it at the beginning. A, you would do B at the midpoint. And yes, you would do immediately following the program. But all A, B, and C are included in D. You're always going to be assessing when you're educating, right? What if you have this grandiose plan to teach this program? You've got everything lined up, you've done your assessment, you know your room, you know who's going to be in there. Then all of a sudden at the beginning, somebody raises their hand and causes you to kind of go off course. Well, as nurses, we're always going to be on our toes, right? We always have to be able to reevaluate whether our teaching is effective. And we do that throughout the whole program. Okay? Questions about that? Okay, number 5. Which of the following characteristics must a learner possess to successfully master psychomotor learning? Okay. Okay, let's take a step back. There's 3 domains of learning, and you have this in your readings. Okay, this would be in chapter, I believe chapter 14. Yeah, it's in chapter 14. Got 3 domains of learning: cognitive, affective with an A, and psychomotor. We all possess all 3 domains. However, one, maybe 2, but one is generally primary to us. Okay, everybody has all 3. Cognitive is thinking, the thinking part of it. Can you hear the information? Can you understand it? Can you interpret it? And can you act on it? You all know somebody that thinks a lot, thinks through things. Some of you think through exam questions too much. That's the thinking. Your primary domain is probably cognitive. Okay, the feeling part is your affective. How do you feel about what you're teaching? Let's say you're a participant. I use the example of, let's say you're having to go for your job. You have to go to this annual training about lifting, proper lifting. You've been to it every year, right? And it's just, you're busy. You don't want to leave your patients for an hour, but you have to go to this training. It's an annual training, right? And you're thinking, oh, here we go again. Well, you don't really have the right, what if there's new information to be provided? Right? And you're going in with think of the people you're teaching, you're going with the attitude of, oh, am I going to learn anything from this? I've done this every year for 5 years. What can be new? Okay, so the affective is the feeling part of it. What are your attitudes and beliefs going into that in service? Well, think about who you're teaching. What if you've got a lot of primary affective learners and they don't want to be there? They have to be there, but they don't want to be there. How do you pull them in and make sure they understand what the new evidence-based practice is for whatever you're teaching? Does that make sense? And then the third is your psychomotor learning. That's your hands-on. And that's what this question is about. Okay, this is, for me, I'll use my example in the schools. This is teaching a kid how to use the glucometer. Hands-on. So A is a correct answer, the necessary ability to perform the skill. They have some kind of a sensory image on how to perform the skill, and they have opportunities to practice it. That's psychomotor. I'm a psychomotor learner. I like hands-on stuff. It's hard I do have a cognitive domain, but it's way less important to me than the psychomotor part of it. And the psychomotor also, another word for the psychomotor domain is that teach back, right? Where you're providing the information and having them teach back what they learn. Okay, so psychomotor learning depends on learning depends on three conditions. Okay, the necessary ability including both cognitive and psychomotor ability. How to carry out the skill, right? An example of that, when you're teaching a group of women how to cook, let's say, heart-healthy meals. Ask the women to describe their kitchen and how they would actually go about shopping, thinking through it, right? And then opportunities to practice. All right, so know your three domains of learning: cognitive, affective. Did I explain them? I know the question's about psychomotor, but there's also two others. Okay? Any questions about that question? Okay, which of the following is most closely related to poor health? Okay, before we even answer this question, what is the most important thing to consider when we're assessing health of an individual, a family, or a community? What is the most important thing to assess first? It's the stability, the financial stability of the person, the family, the community. I'm just answering this question overall. Okay, we know that low socioeconomic status is related to a lot. In this question, it's poor health. But living in poverty, having a low socioeconomic status, what other things does that impact? Does it affect maybe access to health? Access to education?
Different types of food.
Access to good nutrition? Good nutritional foods? What else does it? What is overall low, let's say living in poverty, low socioeconomic status? What else does it impact?
Lack of transportation. To, like,
Transportation.
whatever you need.
Absolutely. What else? You should be able to fire off lots of things here. It affects morbidity, mortality. My point is that one of the things we learn in this class when we talk about vulnerable populations and community nursing is that the financial stability of somebody, individual, family, community, affects everything. Everything. Okay? Let's read the rationale. Socioeconomic status is related to mortality and morbidity for almost every single disease. Think about the rural population. Think about the migrant farm workers, right? People live in poverty, poor Americans, right? Their mortality rate is several times higher than that of income Americans, right? And that's even after I'm looking at the rationale, even looking at age, sex, race, education, risky behaviors. Okay? There's a link between poor health, socioeconomic status. There's a link to poor housing, malnutrition, inadequate sanitation, higher risk jobs, hazardous occupations. It's a cumulative effect, right? Okay, number 7, which of the following statements made by a caregiver of an older adult should alert the nurse to assess for evidence of elder abuse? Did anybody get this question wrong? Okay, well, the correct answer is A, right? Mom's always into something, can't seem to stay still. So I've been giving her half of her Valium so she can relax so I can get some rest. What is that? What's that considered? Ivana's doing this. I get it, but what's it considered? What's this question about?
Abuse.
Abuse. Neglect, abuse and neglect. All right, so obviously the rationale is giving medication to induce confusion or drowsiness so that elders will be less troublesome or giving them half the dose. It's elder abuse. And we know from our readings that elder abuse is very prevalent. Okay. All the other examples are okay. That's not considered abuse, but any kind of impact like that when you're messing with medications or finances, what are some other, this is one example of elder abuse. What's some other examples of elder abuse? Let's say you're the home health nurse going into the family's home of elderly clients. Maybe they have a caregiver, maybe their kids are taking care of them. What are some other things you look for?
Oh,
What kind-
when stealing their money or like, yeah,
Stealing
or
their
stealing
money.
in stuff that's like entrusted to you.
Say that again. Say that last part again.
Like if they like trusted you with something and you just like
Right.
abuse it.
Right. What about verbal abuse? From a child or a caregiver? Withholding things, verbal abuse. What else? What else might you observe when you're observing for any kind of neglect or abuse?
Bruises on their body.
Say that again.
Bruises on their body.
Bruises, physical abuse, right? So you got physical abuse, you may have financial abuse, but you certainly have emotional and psychological abuse. Elderly are very vulnerable, are they not? Very vulnerable. Okay, which of the following is the most probable cause of the increase in new emerging infectious diseases? Well, A is clearly the right answer. Activities or behaviors of us, including changes in environment. Right? Most of the emergent factors are consequences of activities and behavior by us, human hosts, and the environmental changes. The examples given is deforestation, urbanization, industrialization. Number 9, a school nurse asks a class about the ways HIV can be transmitted. Which of the following comments by a student indicates a need for additional teaching? What kind of question is this?
Which one is wrong?
Yeah, well, is it a positively framed question or a negatively framed question? It's a negatively framed question, right? Because you're looking for something that somebody says that's incorrect or wrong or requires clarification or reteaching or re-education. Obviously, B is the correct answer. Right? And think of the age group. This is a school nurse, so she's working with, he or she's working with school-age children. Right? That may be a very appropriate response from a kid in schools. So you have to re-educate them. And that's what the rationale is about. Obviously, we know HIV isn't transmitted through casual contact, such as sitting next to somebody, touching or hugging somebody. Right? But understand this rationale. There's questions about infectious diseases like HIV on the exam. Right? Know how it's transmitted. Exposure to blood, semen, vaginal secretions, breast milk, sharing needles, syringes, other equipment. We all know this, right? It's also going to be spread by perinatal transmission from a mom to a baby, through breastfeeding, transfusions that maybe are contaminated blood, right? Worldwide, interestingly, worldwide, the largest number of HIV infections result from heterosexual transmission. Did you know that? Okay, question number 10. A nurse is reading PPD tests 24 hours after another nurse administered them. Which of the following findings would cause a nurse to interpret the results as being positive? Did you learn about this in Med-Surg? TB and PPD testing, right? So we know that when interpreting a TB skin test, right? 10 mm's of swelling, increased firmness, especially with somebody who's released from a correctional facility. Because what do we know about correctional facilities and the increased risk for TB? Right? Should have picked that up in your reading. Okay. We're going to jump back to our study guide. So I want to make sure I covered everything. We covered the community assessment. We talked about the domains of learning. This is what the study guide is going to ask you to do. Review the domains of learning. Cognitive, affective, psychomotor. I'm just highlighting the sections we covered today. Let's talk about this second bullet because we haven't talked about this with regards to health education. What do we need? What do we mean when we talk about health literacy? What does that mean? What's health literacy?
Like being
You-
able to actually understand medical terms and things like that.
Exactly. Right. And I don't say low literacy as a punitive label, but there's a lot of lay people that are very low literate, have very low literacy when it comes to their healthcare. Right? Maybe not understanding how, and let's throw in a language barrier, or let's throw in a cultural issue. Right? May have a hard time communicating what's going on. May have a hard time understanding what the discharge instructions say. Maybe have a hard time understanding what the plan of care is going forward. Wow, how do you address this? Because you've probably already dealt with it, right? In all of your work settings. Not everybody understands all the health terminology and instructions. How do you present this if this is a client or a family member that has low literacy, has a language barrier, has a cultural issue with the way the plan of care is going forward? What do you do? How do you accommodate these people? What can help to increase their literacy?
Speech back?
Pardon me? Teach
The
back?
Teach back method.
Yeah. Maybe you, if it's a language barrier, maybe you need an interpreter. Right? If there's no interpreter, maybe you try and use some of the family members. But again, you got to be careful with that too because of your assessment of their literacy level. Do they understand? Maybe providing information in their primary language. I know in the schools, like our immunization paperwork, we had it in 10 different languages, right? Because to send home immunization compliance letters in English when you have a Russian speaking family, they don't get it. Right? You know, those calls you make for English, press 1, for Spanish, press 2, for 3, press Vietnamese. That's what that's part of those are strategies to work with individuals, clients, parents, communities that have low literacy levels. Language is an issue. Okay. I think we covered this pretty good, the using of health information. Economic influences, that's one of the topics from this week. What are the economic influences on healthcare? There's a lot. Okay, we know in the United States, we spend the most money on healthcare from all over the world, but we don't have the best outcomes. That's problematic, right? You would expect you spend the most money, you have the best outcomes. That's not the case. Okay, it's right down here. United States leads the world in healthcare spending, but not in healthcare outcomes. Okay, so here, a couple of examples of primary prevention. Let's say you're working with a family. Okay, let's say the insurance company, they've been diagnosed with whatever. They need a medication that is not covered by their insurance. You, as the patient advocate, is going to get with that insurance company and try and negotiate how we are able to get the client that. Maybe it's, I've spoke with the doctor, I've looked forward, and this client is going to have many more hospital admissions, which is going to be much more costly than if you would just provide the medication at no cost to the client. Does that make sense? That's an economic influence. That's a role as a nurse that you would take on, right? We're so focused. Our healthcare system is so focused on reactionary, acute care. We take care of problems when they happen. Where it would be so cost effective if we could move, and we are, it's slow, but we are moving towards primary preventative services, being proactive. Does that make sense? Using health information, we talked about violence and human abuse. That was in one of our questions about elder abuse, but there's so many types of violence everywhere in your hospital, in your work settings, in your hospitals, in the schools, in facilities, right? What kinds of violence might we come upon? Domestic violence, intimate partner violence, assault. I mean, suicide is violence against yourself. So make sure you review in chapter 27. That's your violence and human abuse chapter. Make sure you have a good understanding of the types of violence. I mean, there's a lot of types of violence, right? In the schools, I dealt with suicide, bullying, harassment, assault, weapons in schools. Okay, violence and human abuse is a huge issue, not only in our communities, but overall. Okay, and here's some examples. You'll see this when you review your study guide. Some primary prevention activities, right? What kinds of primary prevention activities can we do in the schools that might help reduce or prevent violence? And there's 5 bullets of some examples, so make sure you review that. Okay, then the last topic to cover before we do our case study is infectious disease prevention and control. Okay, that is chapters 11 and 12. Please review your Healthy People 2030 goals and objectives with regards to immunizations. I'm not sure if that box is in chapter 11 or 12, but please review your Healthy People 2030 immunization and infectious disease areas of focus. Healthy People 2030 goals, vaccine preventable infectious diseases. So the more we can increase vaccinations, the hope is to prevent vaccine preventable infectious diseases. Reduction of STDs, reduction of pneumococcal infections, and required of reduction in associated infections within the hospital. Okay, we know that vaccines are one of the most effective methods of preventing and controlling communicable diseases. So here's a question, and I dealt with it all the time. What do you do if a parent does not want to vaccinate their children? Do you tell them they have to? No. Emily's shaking her head no. Okay. Let's say you have 10% of your school that's not vaccinated. What's our best intervention with those parents? What can we do?
Educate them on the vaccines and why you should-
Exactly.
what they're
Good
for.
job, Alexa. Good job. That's exactly right. That's all I could do with the parents is educate them on the importance and how important they are, right? But if they chose not to, as we know with vaccines, if you have kids in schools and you're not vaccinated, you can do a personal exemption. I just don't feel like it. Religious exemption. Our religion doesn't allow for vaccines. And medical exemption. Maybe the kid has a disease or is on a medication that it's not compatible with vaccines. Okay, but my point is you can't be punitive, you can't be judgmental. All you can do is educate, right? But you bet if you're in the schools, you better have a plan that if you have an outbreak of something, pertussis, measles, what's your plan for those parents and those kids? Right? My plan, I had a short list of parents that needed to be called. We have an outbreak of pertussis, probably best that you keep your kid home because they're not vaccinated, not being exclusionary, but you're not vaccinated. If they're exposed and they get sick, they're going to be a lot sicker without the vaccine. There's a very positive way to communicate that. Okay. Okay. So that's covering most of the we covered community assessment evaluation, health education. We talked about that, economic influences, violence and human abuse. Please review the types of violence in chapter 27, and then infectious disease control and prevention. Okay. So does that give you a good overall kind of synopsis? It's kind of a summary. And then with the quizzes, we had a lot of mixed questions in the quizzes, so we covered a lot in the quizzes. Okay. So the case study I came up with today for you guys is health education in the community. I sent it to you in an announcement mid-morning. I'm going to break you all into 3 groups in a breakout room. Okay. If you're in room 1, you're going to answer question 1. If you're in room 2, you're going to answer question 2. Room 3, question 3. So I'll put you in a breakout room. We'll stay in there for maybe 5 minutes. Okay. And then we'll come back and we'll answer the questions and go through the rationale. I really like this case study. It really reinforces the health education in the communities. Because if you think about it, what is most of our, as a community nurse and nursing in general, what's the majority of our jobs? Education. Right? Okay. Let me get you guys into the rooms. Does anybody have any questions about any of the content we've covered? Okay. Helpful? Reinforcing? Okay. So just somebody in the group, I mean, as many people as you want can pull up the case study, but one person needs it, and you can read it to the rest of the group. All right. Okay, join your rooms and I'll see you in a couple of minutes. Haley, did you get an invitation? Okay. Genesis, did you get an invitation? Okay.
And optimal learning and
See.
yeah, I definitely feel like it's C. Especially, one of the keywords in there is first step.
You guys done?
We're trying to figure out what the answer is.
How you coming? You all set?
Yeah, we got the answer.
Okay, fantastic. Get your answers? Did you like that case study?
The good
I
one.
think it's a good one to reinforce the health education. If I had to pick any of the topics in the last 2 weeks, we had 5 different concepts. Health education is the most important. I mean, they're all important, but that's most important. I'm going to share my screen and bring up my version of the case study, which has the answers and the rationale. Let's go through that. Okay. All right, so school nurses providing educate, and plus this is a school nurse one, which is kind of in my backyard. So I like this. School nurse provides education to the students, parents, and faculty with the intent of providing individuals or groups with the tools to make informed decisions about their healthcare needs. That's what we do, right? Health education in the schools is aimed at promoting healthy habits, lifestyles, trying to prevent illnesses, and teaching measures to identify problems at an early stage. An important factor in this process is for the nurse to set a good example. All right, maybe in terms of weight management, physical activity, lifestyle choices. One of the things we didn't talk about with health education, and I think we'll get to this in one of the questions, is being comfortable in your role, right? Having the credibility with your audience, right? Not only is there sometimes learner-related barriers, but there's educator-related barriers. You ever gone to an in-service or listened to something that you know the person kind of doesn't know what they're talking about? You know, so that's a big part of health education doing is being confident. You've done your research, you're ready to roll, you know what you're teaching these kids. Right? Sometimes in the school, I would start in the mornings, maybe do it in a preschool, teaching them how to wash their hands or how to not put their hands on their mouth. And by the end of the day, I was in a high school teaching about safe sex. You know, one of the things about health education, who's your audience? What barriers can you identify that might be an issue with teaching? The other issue with teaching is motivation. How do you get people motivated that aren't motivated to learn? Right? A lot of issues. And you're going to come across that over and over and over again because lots of what you do is teaching. So, Robert is a school nurse working in an elementary setting. What's one of his first steps in creating an effective educational program for students at his school? Did you guys come up with C, room 1?
Yes.
Right. I mean, you got to start somewhere, right? If you think of your nursing process, you have to do an assessment, right? How do you create a program? Well, first you have to identify what you need to teach about. So identifying the learning needs, right? So look at this rationale. A core public health principle, one of the core health public principles, is asking learners to participate in identifying their learning needs. Right? So when I was doing assessments of schools and what their needs were, I would always include the teachers, the administration, the students, you know, because I like to do a monthly in-service on a topic, lice, ADHD, whatever the needs were of the school, but I would get everybody's input. What do you guys want to learn about? Okay, so education programs are designed to meet the health needs or problems in that population. Right? These programs involve educating individuals of the population. It could be about health promotion, illness prevention, and treatment. I used to meet monthly with all my diabetic students. Right? How's everybody doing? You 8th graders, can you teach the 1st graders? What would you like to say to them to give them confidence that they can take care of themselves? All right, so yes, a lot of your teaching you do in the schools is primary. You're trying to prevent things, but I did a lot of tertiary teaching as well. Right? Kids that had things, group work, kind of the buddy system. How do the older kids help the younger kids with their diabetes? So, okay, same teacher, Mr. Miller creates an educational program for 2nd grade class. So his audience is 2nd graders. They're probably, 7 years old. His topic is related to education and fitness. What would be an appropriate objective? First of all, what are objectives? Got to know what an objective is first. Did you guys come up with C? In room 2? Somebody from room 2 answer me, please.
Yes, we came up with number 3. Number 3.
C, how did you come up? How did you come up with C? What's an objective? Without looking at the rationale.
Objective is something you can measure, no?
Exactly.
You can measure if they learned it by asking them to demonstrate.
Yep. And remember, objectives are short-term criteria, right? They're meant to be building blocks to accomplishing the long-term goal, right? So this example is within 2 weeks, the kids are going to be able to demonstrate 2 activities that they've learned, right? They're short-term, moving towards accomplishing a long-term goal, right? Objectives are written statements. We state them with the intended outcome or expected behavior change, right? But we have to provide them the education on the front end to be able for them to meet those objectives, working towards their long-term goal, right? It has to be measurable. Okay, and then number 3, I love this question. He is educating the children about health promotion activities. So he's doing primary prevention things. He's obese and he goes out and takes smoke breaks. Which of the following might be an educator-related barrier? Educator-related. Did you guys come up with A in room 3?
Yes.
Okay. Yeah. Lack of credibility. We just talked about that. Right? So this is an educator-related barrier, not so much a learner, right? Lack of credibility is a big issue. With respect to certain topics, it is a common educator-related barrier, right? How do we increase our confidence, right? We prepare, right? We are informed, we understand the topic, and we're comfortable presenting it. A lot of people have issues with public speaking or teaching in groups. Okay? Leading by example. Okay? So, education is a really important part of our roles, and we need to be good at it. That's like me coming in to teach this class with 0 community health experience. There's no way I could do it. Well, and I wouldn't do it. Right? Same with you guys. Got to make sure you're comfortable and informed and have researched your whatever you're teaching about. And that's where evidence-based practice comes in as well. Right? Let's say you work on a hospice unit, working with hospice patients, and it's realized that there may be a different kind of medication protocol that will help these clients be less confused, less sleepy, whatever it is, that they can interact better with their physicians, the staff, their families. Right? And you're the hospice nurse. How do you educate everybody in the picture on this new practice, right? For buy-in. Right? So we're not just talking about, me educating kids in schools. I also educated parents. I educated administrators on a variety of topics. We just have to be prepared. Right? So anyway, trying to be mindful of the time. We don't take a break, so we get done 10 minutes early, and I am smack on time right now. I'm pretty proud of myself. Does anybody have any questions that will benefit the whole group? If you have any specific questions, I will stay on. I'm going to stop the recording.